All right. Well, we had a lapse in our LCME YouTube. I don't know what was going on, but we are back in action. And today I am super excited that for our LCME little chat, fireside chat that we're having, I have none other than Dr. Hugh Stoddard, who is joining me today, and we're going to break down some LCME stuff. Dr. Stoddard, would you introduce yourself to the community? Who are you and what do you do?
Well, first of all, since you're in Houston and I'm in Atlanta, we have no use for a fireside in the middle of June. But we'll run with that metaphor anyway.
Fantastic.
I'm Hugh Stoddard. I'm the Assistant Dean for Medical Education Research at Emory University School of Medicine. I am an educator first. My doctorate is in education. I was a high school teacher for 17 years before I got into medical education, which is kind of a step into kindergarten teaching in some respects. What I do here, a variety of things ranging from education research to curriculum management, curriculum oversight, curriculum philosophy. I introduce myself as a philosopher of curriculum. Partly because that really is what I do, and partly because I just like to watch people's head explode when they think about the fact that there is such a thing as a philosophy of curriculum. And along with all of that comes a lot of LCME, particularly in the education, the directly education related elements 6, 7, 8, and 9.
Awesome. And we first met, I don't know how many years ago it was, but I think it was doing a double AMC panel, right? I think.
To be honest, I don't remember exactly when we first met. Whether it was curriculum inventory or doing a panel or
something like that. Yeah,
it's been long enough ago, and we've done enough different things together. It's hard to separate the threads.
It is hard, yes. So we invited you on today because we understand that you were recently at, I forget what they formally call it, but the LCME Shindig, where if you're a school that's going to go up in a couple of years, they have like a little meeting sort of thing. And we thought it would be, I know there was some chatter of this on the listserv, you know, of those things that happened at that meeting, but thought it would be really fun for people who missed that, or just kind of like if they are a visual learner. Like we want to provide options for our visual learners as well, Hugh. Okay, let's be clear. All right. So we thought it would be
the time for my TikTok dances during the visual learner part.
I would love that. Absolutely.
No, you wouldn't.
But we thought maybe if you could share like maybe some of the points that you heard that for people who are not about, you know, who didn't go to the same talk as you did because they don't have one in 2 years, but maybe they have one in 3 years or 4 years. What are some of the things that really kind of hit home for you that they should start thinking about that maybe they're not thinking about, I guess? Any pointers?
Yeah. So let me preface by saying, I told you that I was a teacher. My background is actually in economics and behavioral sciences. So I'm always fascinated by organizational, sociological kinds of features. And you excuse Children's Hospital emergency room is right across the street, if you can hear that noise in the background. But looking at the LCME as an organization in and of itself, and trying to read the tea leaves of exactly where they're going, what's important to them in any given moment. And we get bits and pieces of that through the monthly calls. You know, you listen to the calls and you start to see patterns. And actually, I was on the calls back when they actually were conference phone calls when they first started it, which was about 10 years ago. I've been on pretty much every single one of them, which I think qualifies me for either an award or a commitment.
One of those, yeah.
So going to the prep workshop, and the prep workshop, as you mentioned, is specifically for schools up to 2 years out from their visit. So it's supposed to be for people that are getting ready to move into their suggested timeline for DCI, you know, creating the DCI and the self-study teams and those kinds of things. And so you do pick up a little bit different doing this once every 8 years, as opposed to the monthly things. And there are a couple of things that I really noticed from the workshop that they'd kind of done it a little bit at the meetings, but they really emphasized it in the workshop. And that was they started presenting the intent of elements. And so the first part of the workshop was the usual, basically reading you all the things that you could read on the website if you were so inclined. But then they started saying, well, here's the elements that are commonly cited. And for each of them, they said, well, here's what the element says, and here's what the element means, and here's tips to be successful, and here's things that will cause you problems. So they basically had 4 slides for each element. And they've done this a few months ago on the monthly call, the Connecting with the Secretariat. And I think people are finding that to be really, really helpful.
Yeah.
Because it adds a level of transparency that we don't always get. I mean, without that, sometimes we're left to try and say, well, what is it that they really mean? And the other thing that you do as you're starting to prepare for your visit is you look really closely at one word change in the DCI or one word change in the standards and elements, the structure and function document. And you start saying, okay, so there's one word that's different. So how does that change everything? And for example, I was just looking at this earlier today because yes, I am a nerd also.
Yeah. Yep, that's us.
Yeah. Like for the new structure and function, the standards and elements for 23-24 academic year, under 2.4, sufficiency of administrative staff, they added the word effectively. So it used to say, have enough senior administrative staff necessary to accomplish the missions of the medical school. And so essentially all you had to do was count them. Now it says effectively. That changed, I mean, just that one word changes the whole, and unfortunately, this was not one of the ones that they talked about because it's not commonly cited. But with that word, it's entirely possible that all of a sudden people are going to get cited for not effectively managing. Now, what their metric is, I mean, for so many things, their metric is the student satisfaction. So that may be the metric on 2.4. So having that, being a couple of years out from the visit and noticing these things in much more detail than you do on the monthly basis, that having the 4 slides, like I said, having the intent of those elements, that's huge. That transparency, which all of us really, that's what we really want, is we want transparency. I mean, most people involved in this used to be medical students. And of course, as a medical student, what do? Tell me what to do and I'll do it.
That's right.
And you get through medical school and residency. And so that's really what we want. And that's the way the LCME as an organization operates. I mean, I've been involved in accreditation at the K-12 level, which is very different. It's much more about, what's your mission and what are your values and what are your plans and how are you going to accomplish those plans. And it's very much, this big picture. LCME is very much more narrowly focused. How many faculty do you have? How did the students rate your OB-GYN clerkship? Those kinds of things. So it's a little bit different in their approach. And so that from the workshop, I think was truly one of the most significant changes that I see from what it has been in recent years.
So I think that's a great thing. And I know they started doing that on the secretariat calls too. I just wish that somehow they could incorporate that into the DCI or the elements, right? So you would just know like upfront, right? I know they started writing a few white papers for a couple of the elements. And for me, it was, if you need an entire white paper to explain an element, maybe that's a signal that there's a problem, that that it's not being explicit enough about what is the intent or what is really needed. Because like I say, nobody wakes up and says, I think I'd love to go on probation for the LCME today. Like, I mean, it's like, just like you said, tell us what to do, and to the best of our abilities, we will absolutely do it. But it's that uncertainty or not getting it that is the big problem. Yeah.
And one of the first white papers was actually on element 1.1, which was one, and don't misunderstand me. The LCME elements, they have gotten really, really good. Thinking back to the old days of the 145 standards.
Yep, I remember that. Yep.
That was verging on disastrous, and they really did a nice job. I mean, they had to because of the Department of Ed requirements, but they really did a nice job for the most part of organizing them. But more importantly, they really cover the things that need to be done. And you look at some of them, like 3.3, which is about the diversity, where if you go back even 5 or 6 years ago, all they were doing was numbers. How many people do you have from this group, that group, and the other group? And they've really gotten away from that, and they're really pushing schools to do the right thing. And this is great. Some of the others, like 6.3 with the active learning, trying to push schools away from doing so many lectures and actually get the students to do lifelong learning. That you actually have to prepare them for that lifelong learning. And so that was the first change, was that these elements are quite, they're the appropriate thing that we should be held accountable to do. And the difficult part comes in, well, okay, so what's the metric? How are you going to measure this? And that's where it gets a little bit confusing, because the schools don't feel like they're getting measured the same way by different site visit teams. And so that's why they want the transparency and the clarity. They say, just tell us what it is we're supposed to be doing. We agree this is the right thing to do. Tell us what it is we're supposed to do. Going back to 1.1 and that first white paper, I mean, that was the right thing to do. Yes, you should be doing quality improvement. But what does that look like? Do you need to go out and get a green belt and all these, you've got all these different CQI processes. Is that what they're looking for? Or are they just looking to make sure that you're looking at the standards periodically and not just this bolus of activity within the last 18 months?
Right.
And the white paper actually cleared up a lot of that. So it really has been helpful. And I agree with you that sometimes trying to condense complicated ideas into a sentence or two of an element is very difficult.
Yeah, for sure.
And so really appreciate the expansion of what it is they're looking for, because there are a lot of different ways that you can do this. And what keeps all of us awake at night is we're doing what we think is right. We honestly are making an effort to do this the way we understand it.
Yep.
And then a site visit team swoops in and says, well, that's not the way we understand it, so you're going to get cited.
Right.
And you feel like, well, okay, so from all the efforts and good intentions, we in the old days, we used to call those a seagull visit. Is this PG-13 or what is it?
We are like XXX rated. So say yes. So
yes, we used to call it the seagull visit, where they fly through, they squawk a lot, they shit on everything. And sometimes they feel like that's what your site visit team is doing, is that they haven't taken the time to really understand the nuances of how you've tried to meet the standard, whether it's 1.1 or 3.3 or any of the standards. And so this it seems to be a little bit of a sea change with the LCME, that they're going to make it explicit, and hopefully this is how the site visit teams are going to get trained.
Yeah.
Here's the intent. Here's what you should be looking for when you get there.
No, I do think that would be great because I totally agree on the site team. So 1.1, we were fine with 1.1, but we were at first we were wondering what the story team was going to say because we don't actually have an official committee that meets regularly. We have a team, and then that team goes out, and you can see our CQI everywhere. Like we CQI up the wazoo. But one of the people on our survey visit was just really harping, like, so you don't have a committee. So you don't have a committee. And it's like, show me where it says we have to have a committee. And then please show me how our CQI isn't working, because take a look. And so we ended up not getting cited, but it was just kind of like, again, I feel like some site visitors have a mental model of what they think it should be. And it's like, it doesn't say it's got to be like that. So chill out.
Yeah, and I'm fine with that. I'm fine with them coming with a mental model, but you have to have a dialogue.
Yeah.
Otherwise, they have their mental model. They listen to you talk about it for 45 minutes, and then they say, well, not what I do, so it's wrong.
Right.
If you don't have that dialogue, that you can, if you don't have the dialogue, and this is one of my complaints about the LCME process, is that it's not a dialogue, and they can't tell you here's what's good and here's what's bad.
Right.
And so that's what I really wish was present in the process, is that it would be more like a consultation,
right?
Than this ultra summative kind of a.
For sure. Is there anything that you heard that you're like, that maybe you came as a surprise? What I mean by surprise is just you're like, oh, I hadn't looked at it that way, or like any advice that, on any of the elements that you heard that maybe people who are coming down the pike in 3 or 4 years, they need to like be a little bit more aware of? Or was it pretty consistent kind of with what's in the standards now, what you're thinking?
Well, and keeping in mind that I came at this very much, I'm looking very much at that 6, 7, 8, and 9 standards.
Yeah,
So
right,
10, 11, and, the student affairs ones, there's probably more to them than what caught my attention.
Mm-hmm.
But so many of the standards that I'm particularly concerned with, I feel like they're actually starting to be theory driven.
Okay.
They were just sort of saying, well, it sounds like it's a good idea to do this.
Mm-hmm, mm-hmm.
But now they're starting to get a little bit more of the theory of why active learning might actually be good.
Okay. And
when they say fair and timely assessment, what actually is fair?
Mm-hmm.
Previously, they said fair and timely assessment in 8.8, but the only thing they measured was timeliness. Do you return your grades on time? They never actually asked, do you have standard setting for your pass-fail cut scores? How do you examine your assessments to determine whether they are truly some semblance of fair?
Yeah.
And they seem to be getting a little bit more, that seems to be more present in the way things are changing.
Okay.
The wording is changing and so forth. That's going to make it a little bit more difficult for schools.
Mm-hmm. Yeah.
Because this is very nuanced, and it's not as straightforward as just saying how many weeks does it take to return the clerkship grades.
Right. Yeah.
And so it's going to take more effort on the part of the schools, more effort on the part of the site teams, and more effort from the committee to understand what the school actually is doing and why they're doing it.
I've heard a lot of schools, just in relation to that, if they weren't pass fail for the clinical, which again, I think most are now for the preclinical, but not as many for the clinical. I have heard a lot of chatter about, what, we're just going to change to pass fail and then kind of get rid of that issue, if you will. We're veering a little bit away from LCME, but since I have Dr. Stoddard on the line, what do you think about that?
We just switched our clerkships to 100% pass fail, not multi-tiered, strictly pass fail, not honors, nothing like that. So it's dichotomous, and that went into effect of March this year. So we covered this territory very thoroughly for the last year and a half, thinking about it. And that was part of it, but a bigger part of it was that we really need to turn our assessments into being formative, that our assessments need to be about helping students learn and helping teachers, helping instructors know how students know what students need to learn. That's the point of assessment, not to try and figure out the difference between an A- and a B+.
Yeah.
So it's really driving a culture change. That's what we're pushing here. We really didn't look at the LCME standards as we were making the decisions. Although we do believe that the pass-fail is considerably more fair, that we, in my opinion, as a amateur psychometrician, that we really didn't have good enough instruments to be able to tell you the difference between that we could validly discriminate between an A- and a B+. We can't make that decision, then we probably shouldn't try.
No, I hear you. I love it. And I love the that your assessments should be formative, because I even feel, sometimes we say LCME likes to play gotcha, but sometimes I feel like we're playing gotcha too. And I've seen this for me a lot on the standardized patient exams. So what are those really for, and what are they assessing? And different schools have different thoughts about if they share the checklist or not. And it's like, well, we keep, yes, your standardized patient or might give you some feedback, but we can't share the checklist. Well, why? Like, why can't we share the check? Right? I mean, this is like, don't we want them to like do well at this? And right,
and that kind of the point is
right. I know it's fascinating to me. And again, all the data about, you can still have someone who does check every box on the checklist, and at the end of the day, though, summative, do you want them to be your doctor, is like a hell no, right? And so that's significant, right? But as far as like making sure they have the skills and those sorts of things, what you're teaching, like why would we keep that a secret? So it's just, that's just my personal pet peeve sort of thing. It's just, and I'm sure now I'll get like, flood of, issues, but hey, some controversy is always good. To up ratings. Yes. Like what else can we say that's controversial? I don't know. Yes. So, but it's interesting. So yeah.
Drive the traffic to your site.
There you go. Yes. Of course, it would be better if we were fighting, but I just don't think that's possible. So kind of a bummer, but
I don't know. Sounds like a challenge. I can pick up something.
Well, any final words that you want to impart to anybody who might be listening about getting ready for their visit?
The most, I mean, the fundamental thing really hasn't changed. The fundamental thing is pay careful attention, because you hear you hear various people in the LCME use the phrase, they need to take this seriously. And so, and there's good reason to, not just because, and it's not that they're on a power trip, but you need to take it seriously because it's good education. They're asking us to do what we should be doing in order to do good education. And so by taking it seriously, meaning pay attention all 8 years. I mean, don't let things languish. The other thing, and we have tried to live by this, it kind of hurt us in 2016 on our last visit, but we really aspire to go beyond what the standards say.
Absolutely.
And sometimes it makes it hard to explain what you're doing to people coming from the outside. It's risky. It's risky, but we've been supported in taking that risk because we believe it's the right thing to do.
That's awesome. Yeah, that's awesome. Well, I want to thank you for joining me, and maybe you'll come back another time. We'll see if we could, convince you to possibly do that sometime, to discuss when we have maybe a controversial topic to bring up. I don't know what that is, but we'll figure it out. So, but thank you so much. Really, really appreciate it. And that's it for now for this segment of this LCME after the Secretariat call. This was kind of like after the LCME survey visit call, but whatever. Okay. All right.
Thanks so much for the invitation.
Hey, no problem. All right. Goodbye, everybody.